Welcome back to Our Town, Our Time, and we just heard Al's story about the walk-in elegant tub, and I'm joined now by Michale Manes, who is owner and CEO of Right at Home Home Care out of Dayton, Ohio. Is that correct?
That's correct.
Welcome to the show.
Thank you.
You are a home care professional, so tell us the safety features and some of the benefits to this as you see it in your industry.
Well, a couple things. When we work with a client that already has an elegant tub, it gives us a huge advantage for being able to keep that person in their home long term. Because one of the things we always worry about is an elderly person, bathing frequently or correctly or what have you.
Right. Most of the time, probably not, huh?
A lot of times not, especially if there's memory issues. So when we can utilize technology like this, it is not only saves our people time, it helps the individual tremendously because it's of a great health benefit, and there's a huge safety factor involved as well.
Right. And with the elegant walk-in tubs, I'm sure with you being in the industry, you've seen all kinds come and go. What drew you to this particular company in this tub?
Well, they do what they say they're going to do, number one, which always helps. And
it does help.
we do a lot of private care in the greater Dayton area, and so it's a service business, and if we say we're going to do something or we refer a partner, we need to know they're going to deliver.
Right.
They have basically a turnkey solution that can be done with minimal interruption to the household. So basically in and out, done correctly, done right the first time, and then the senior who's ever utilizing it can benefit from it immediately.
Right. And I would think from a home care standpoint, you have people in the home that help, that it would cut down on some of the, I guess, dignity issues and things with people.
Oh, absolutely. There's a whole range of, people feel safe when they see an elegant tub for starters.
Right.
And not only, of course, it looks nice too,
right?
But
yeah, they do.
But there's a safety factor, and safety lessens anxiety for our patients. So the aides then have much more confidence to then steer that individual towards a quality bathing experience with minimal interruption or minimal challenges, and they're able to get it done, and that just translates into healthier living.
That's right, a quality of life that they didn't have before,
which to your point translates into dignity. It all flows together.
Sure. So, and in your field, as far as the home care, these tubs have helped just the families and your caregivers. Are your caregivers there all the time, or they come periodically, or?
Everything, sometimes 24 hours, sometimes a couple days a week, sometimes 8 to 12 hours a day. It just depends on the situation.
Right.
But 9 times out of 10, we're in a personal care bathing situation.
Okay.
And those tubs are just a tremendous advantage to the individual and the household.
Right.
At that point.
From, like you said, from dignity and from all aspects of it. And then from a health standpoint, what have you seen with the use of the tubs?
Well, if we walk into a situation where, say, somebody isn't bathing, okay, and if they're not bathing, that's a red flag. It may also mean they're not taking their medications when they're supposed to, eating or hydrating, things like that. If we see somebody who's not bathing, there's a very high probability they're going to get some infection, like a urinary tract infection or something like that. And if you're elderly, that could mean dehydration, a trip to the hospital, or even worse than that. And these tubs, while they can't prevent everything, they minimize those types of health issues. And most people that we've met, they kind of treat it like a spa. They want to just jump in and go into it. And some people, we actually have to, we have to beat them there.
Time to get out.
Right. They want to stay in there, or they want to get in all the time.
Right.
Because someone may look at it as a sort of a spa or hot tub experience, and if we can get that with our patients, that's just absolutely wonderful. At the end of the day, it translates into healthier living.
Right. And I would think the therapeutic part of it with the circulation and different things that people would have going on that have made them homebound, it would be a tremendous help.
I mean, I certainly haven't met a doctor or a nurse that would say, it's that you shouldn't have that tub.
Yeah, don't
in
get
the
in
house.
that tub.
Right. They can't recommend them fast enough, and neither would we. So
Right.
And one of the things I like about elegant walk-in tubs is the quality is very high, and the price doesn't break the bank like some of the other ones I've seen. And that's very important.
Well, and I find them very unique that they're all together. They can do it in one day in most cases, and that it's pretty non-invasive to your home.
Oh, absolutely. You don't feel like you have a commercial contracting crew in your home, interrupting everything. And, that's important to us and a partner too, because, there's been situations where we've had tubs put in the past by other companies, and we had to relocate the person to a hotel for a couple of days.
Really?
Absolutely, because they interrupted their household.
Sure,
completely.
and they have to be able to use their bathroom and bathe and everything else, I guess.
We don't have that with elegant walk-in tubs. We
Right.
know the timetable, and it's reasonable, and we can plan around it, and everybody appreciates it.
Great. Well, Mike, Michael, sorry. I appreciate you coming on the show and talking to us from a different standpoint about the health benefits and things of that sort that people may not think about.
Absolutely.
When they're looking into one of the walk-in elegant tubs.
All right, thank you, Michelle.
And we're going to be right back in just a minute to Our Town, Our Time, and I've got some exciting news to share with you in the next segment.